Hey guys, welcome to A Little Help for Our Friends, the podcast for people with loved ones struggling with mental health. Hey Little Helpers, welcome back. Today we have a really cool topic. It's one, I always love doing these episodes where it's a concept that it can apply really broadly, but we do see it in certain diagnoses more than others. The concept is self-hatred, self-loathing, something that a lot of people unfortunately struggle with at different parts in our lives. But to help us with this topic is, how do you pronounce your last name, Blaise? Aguirre?
Like a car gear, Dr.
Aguirre?
Aguirre, Blaise Aguirre.
Blaise Aguirre.
Aguirre
Okay.
is French, so
Okay.
which is also cool.
Helping us with this topic is Dr. Blaise Aguirre. He is a child and adolescent psychiatrist. He's a trainer in and specializes in dialectical behavior therapy, which should be familiar to many of our listeners, as well as other treatments such as mentalization-based treatment for borderline personality disorder and associated conditions. He is the founding medical director of 3 East Continuum of Care, which is an array of programs for teens that uses DBT to target self-endangering behaviors and BPD symptoms. He's been a staff psychiatrist at McLean Hospital at Harvard since 2000 and is nationally and internationally recognized for his extensive work in the treatment of mood and personality disorders. He's the author and co-author of many books, including Borderline Personality Disorders in Adolescence, Mindfulness for Borderline Personality Disorder, Coping with BPD, and Fighting Back. Blaise, welcome to our show, and thank you so much for offering us your
And
expertise.
now with both.
For
Subtle
those,
plug.
for those of you with YouTube, you will have just seen Blaise raise a book called I Hate Myself. And we just saw the message "I hate myself" come completely over the screen, so that is why we were
Awesome.
giggling.
Let me
But
jump
Blaise,
in.
welcome.
Oh, thank you so much for having me on, and I really appreciate the willingness of thinking people to have a discussion about this really complicated topic. So thanks tremendously for having me on.
Awesome. And Kibby, I'm gonna jump over to you to tell us about Cool of Mind.
Yeah, just jumping in with all different kinds of plugs for, for things, but I'm really excited for this conversation with Dr. Aguirre, and we'll definitely link where they can find your book and other resources after this. So,
Mhm.
but I also mentioned that for anyone who wants hands-on help with navigating their emotionally challenging relationships with loved ones with mental health issues like borderline personality disorder, which we'll talk about, anger issues, narcissism, and other things like that, check out Kulamind, KULAMIND.com, or you could check out our show notes and you find a link and you could talk to us. You know, you could book a free consultation call to learn a little bit more about how we can help you with navigating a relationship like that. So, done with all that, let's jump into self-hatred. Tell
And
us a
that,
little bit about yeah, you go.
no, it's such an aggressive sounding title, but I think it's something that
Mhm.
so many of us have struggled with at different parts of our
Mhm.
lives. That was me as a
Yeah.
teen.
Mhm.
But you, I know, have studied this mostly in the context of BPD. Can you tell us
Mhm.
how you came to this topic? What interested you about it?
Mhm. Yeah, but I was struck by your comment about how aggressive it sounded. This whole concept of self-hatred, and I remember that when I was speaking to a lot of my patients who've got borderline personality disorder, eating disorders, severe eating disorders, and other conditions, and I said, I'm working on this project. What should we call it? And then, should we call it "I loathe myself," or like learn to love yourself or something like that. And they all, to a person, said that they would never buy such a book. I said, why not? He says, because it doesn't capture the experience. I said, well, what is that? What is the experience? And they said, like, you don't understand. I hate myself. And so it wasn't they didn't want some sort of euphemistic, watered down version of what the experience was. Um, and uh, and and the reason it came about was that for people who know conditions like borderline personality disorder, we know that suicidal thinking and suicide attempts is very high. And unfortunately, in people who are hospitalized with borderline personality disorder, the suicide rate is about 10%, which is a tragic number. Any number, any loss is a tragedy, but certainly 10% is a very high number. And using dialectical behavior therapy in our adolescent residential treatment center, we brought the suicide rate way, way down. Nevertheless, we did lose some kids. And when I was sort of reviewing what we'd missed in those kids, I realized that throughout their record, they would talk about the self-hatred. And when I started to work with patients and I asked them about their self-hatred, they, many patients said, no, I don't hate myself. I don't like some of the things I do. I'm dissatisfied with certain things. I'd like some things to change. But a few of them talked about this core self-hatred, that they had hated themselves ever since the beginning. And that even if depression, anxiety, substance use had improved, that self-hatred persisted. And when I asked them what the problem with that was, they would talk about the way it would impact their relationships with others, their love choices, their friendship choices, their academic choices, their employment choices. They would always put themselves down, believing that they didn't deserve more. And fundamentally, they felt that they were a burden to themselves and to the people that love them and to the rest of the world, and that the world would be better off without them. And that independent of all other behavioral improvement, the self-hatred persisted, and it was really linked to suicidal thoughts, actions, and behaviors. And I thought, okay, well, if we understand that this is a vulnerability factor, we have to begin to target it some way. So, as a DBT therapist, I tried to use DBT techniques, and they just didn't work.
Can you give us a picture of what self-hatred looks like? How does it show up? If in people who aren't as familiar with, oh, I hate myself, like I
Mm-hmm.
don't deserve this. What are the thoughts or behaviors that people tend to do when
Mm-hmm.
they hate themselves?
Yeah, so there's certainly a lot of self-criticism, a lot of self-judgment. There's a lot of self-blame. So everything that goes wrong is their fault. Every time something goes badly, it's because there's something flawed with them. Every time they mess up in life, that we all do. I think I did in my last session. Um, you know, it's uh, um, I'm a terrible person. So there's a lot of self-judgment. Anytime things work out well, it was luck. There's a lot of people-pleasing behavior. There's a lot of perfectionism. There's a creating a standard that is just very, very hard to meet. And that when I would talk with my patients, they would say things that weren't very kind towards themselves, and I would say like, "Wow, it doesn't sound like you like yourself very much," and they'd say, "Actually, I don't." I said, "Well, how badly? How bad is it?" And they said, "To be honest, I hate myself." And so those are the behaviors. A lot of self-judgment, self-criticism. And by the way, almost all of the people that I met with self-hatred were highly sensitive people. And I mean, I'm a highly sensitive person. And so if you look at my name, Blaise, and my mother was Isabel, Isabel, and same letters. And she was my, I don't know, my angel, like she was somebody who could validate a highly sensitive person. So, I mean, I'm sure had I had very toxic and invalidating environments, I probably also would have hated myself for being so sensitive. And I think that highly sensitive people are at greater risk for self-hatred.
My thesis and dissertation research is on BPD, shame, and mentalization. So
Mm,
you're a bit of a gold mine for me.
mm.
But the kind of shame theorists that I was following were kind of telling the story of, I mean, the biosocial model effectively, but that when a child comes into the world and starts emoting, and those are the only tools it has is to cry, right? And then eventually to smile, and it gets met with totally opposite information, that there's kind of an incapability of forming a solid sense of self because the very tools that they begin life with don't work.
Hmm.
And that creates such a sense of confusion, and it's really impossible to build on that.
Hmm.
And then there's this shame proneness that comes in. Is that kind of a formulation of how this happens, or
Yeah.
what would you add to it? Okay.
Yeah, no, I think that that's beautifully theoretically and real life experience stated. I mean, it's I think that that's all true because I mean, a fish doesn't know what it's like to be out of water. It just like, it doesn't understand water is separate from itself. It's sort of like, and it's just like that's the environment in which it lives. And it's only when you take it out that it says, okay, maybe I do need to be in water. So maybe it's not a perfect analogy, but I'm just saying it's like that's the uh, emotional environment, emotional ocean in which that young child is living. And so I haven't met too many adults, although I met one recently who developed self-hatred when not having it in childhood. And that's because I think that when bad things happen to adults, they can contextualize it, and there's often uh, people in their environment that they can turn to, good friends, maybe relatives and other people. They say, hey, this thing happened. And they'll say, wow, that sounds terrible. But a child doesn't have the context and the words to be able to to say something.
It,
Interesting.
it strikes me that you're working with like two populations that would both have self-hatred, but for different reasons, like BPD and also adolescence. Like,
Hmm.
I hated
Hmm.
myself in adolescence for a period, and I think it was because I was developing a new identity and I didn't have any skills yet to be successful at it. And so all I was
Hmm.
seeing was myself messing up all the time, like me being
Hmm.
bad at socializing, bad at
Hmm.
getting guys to like me, bad at having friends. Like,
Hmm.
but that's like not contextualized yet, like you're talking about in adulthood, but it also doesn't stem from childhood and it's not based on this kind of undergirding of not being validated or listened to or understood in any way. So it's just, I don't know what my question is here, but it seems like you've got two major forces colliding at the same time.
No, I think you're absolutely right. But by, just by extrapolation, you would have been a like highly sensitive child, a highly sensitive teen, because I think that kids who have, um, uh, you insult them, you say, I don't know, you're not pretty, whatever the affirmation would be to say a girl or to a guy or whatever, you know, uh, if I say to a guy, you're not strong enough or your muscles aren't big enough and he just doesn't care, well, so what? Okay, let's just move on. But high sensitivity, it's like the gorilla glue for labels. If you're a highly sensitive person, I say, you're not that pretty. You're not tall enough. You're not curvy enough. You're not, pretty, whatever it is. Like that, there's just like that's going to stick to you much, much more as a highly sensitive person than someone who's not highly sensitive.
Do you see common styles of parenting or childhood that leads to the self-hatred? I only ask this because we've learned over and over that in an invalidating environment,
Hmm.
critical parents, not supportive
Hmm.
with
Hmm.
highly sensitive kids, leads to this kind of self-hatred. However,
Hmm. Hmm.
now that I'm a mom and I have
Hmm.
a 2.5-year-old who has big feelings,
Hmm.
you know, learning this professionally, sometimes when he yells for the 50th time, I'm like, come on, it's just a sock, okay?
Exactly.
Your feelings are not legitimate right now. Just get that sock on. So am I doing it, or what do you see as the common pathway for someone to learn to hate themselves?
Yeah. So okay. So you have so again, you start off with the biology, which is that of high sensitivity. Okay, and then um, uh, I'll give you an example. I mean, and by the way, most of the parents that I meet are ultra loving parents. So I have not met a parent who said, my goal for my child is to go to Harvard and to hate themselves.
Mhm.
It's like no one wants to have a person who struggles in their life. Okay, but but for instance, I had a kid, parents had gone to a very prominent West Coast university, both parents. The child's two siblings had gone to the same university. You walked in to their house, and they had cups from this university. They had, duvet covers. They painted the doors in the same color and stuff like that. And so, but this kid was not academically gifted at all, but was super artistically talented. Now, the child was learning that in order to be appreciated in this family, she had to go to this school. And no one was saying that to her. But it was explicit. It just in the way in which either the school was talked about, the signaling in the house, was that that's what we value. And so the child thought like, wow, I'm not as smart as my siblings. I'm not as uh, kind of athletically talented as my siblings. I'm not going to make it there. And started to really devalue. And then in that context, every time something would go wrong, maybe they'd get a B in a test or something like that. It would reinforce this idea that they were flawed in a way, and then in the context of a sexual assault in school, it just pushed her over the edge, and then she just said like, like I'm never going to be enough. There's this question of not enoughness. So yes, of course, if you're a highly sensitive child, there's sexual, physical, emotional abuse, and you don't have uh, somebody who can validate and protect you, um, it's the only thing that you're going to learn. Now, with your child, I mean, it's so funny. I went for a hike with my son, the social worker. He's now a social worker, and I said we went hiking in the desert outside of Vegas, and I said, "Son of mine, tell me all the brilliant things that I told you as a child, and all the things that you learned." And he said, "Honestly, I can't remember a single thing, but I remember how I felt around you. I remembered feeling safe. I remember feeling listened to." So I think that it's not so much that you say, you should brush your teeth 20 times one way and 20 times the other way, and that way, like none of that. That's not the thing. The thing is that they feel seen, they feel heard, they feel validated, that you can say, and then also that I can admit my own mistakes, like, yeah, I screwed up. I screwed up and I yelled at you and I was just very frustrated and I made a mistake and, or yeah, maybe you did deserve to be yelled at because, I told you not to take the car and you're 14 years old and, what were you doing driving the car, But, so I think, yes, it's not so much that you're yelling at your kid because they've taken the sock for the 50th time, but it's about a seeingness, a beingness. It's about not rejecting um, the child's legitimate statements of dissatisfaction and not enoughness. The other thing is that how often, when somebody tells us, nobody loves me, I don't have any friends at school, do we reject that by saying that's just not true?
Right.
Now, it's probably not true. It probably isn't. But no one has been convinced that they're lovable by being told that they were lovable.
Yeah.
And so it's not like, okay, I love you, oh, okay, that's great. Now I love myself. It's sort of saying like, how did you get to the idea that nobody likes you at school? And often it has to do with like maybe the best friend has another group of friends. And so this one really essential person doesn't like them anymore. And so what happens is that becomes a catastrophe for the highly sensitive person, and it feels as if nobody loves them. But when you're able to sit there and listen, um, it actually brings the emotions down, and they're able to reflect on the absoluteness of their statement.
So, do you see? Okay, so I mean, are we seeing kids as young as like 7 experiencing this self-hatred and then it just keeps going, or is it more something that develops in adolescence? Like what is the development of this?
Yeah, so I think that I don't know, when I ask my patients, like, when did you start hating yourself? I mean, most say sometime around kindergarten. And but if I said, like, if I'd asked you, do you hate yourself? That would not have been a concept.
Right.
So there's this internal dissatisfaction that is showing up. It's not formulated as self-hatred. It's formulated as being flawed. It's like I cannot, I can no longer charm my parents. I am no longer enough for my parents. I am an embarrassment. I'm a disappointment. I am valueless. And this is whether, I mean, it's possible that a parent is saying, you're not as good as your siblings. Um, uh, but also, more often than not, it's not explicitly stated. It's just like how they're internalizing those experiences. Um, and then as they get older and they begin to formulate a kind of a more complex sense of who they are, in early adolescence, um, they start to make a lot of comparisons. And when they make those comparisons, uh, they see that they don't have what other people seem to have. And then they feel that they're very, very flawed. So even though a lot of those early primordial ideas are floating around in those 5 to 10, in the ooze of the 5 to 10 year old brain, the formulation, the determination of self-hatred seems to show up in, early, uh, in the early teenage years.
Hmm.
Yeah.
This is a totally self-serving question because I'm basically asking you the answer of my dissertation. But since you do mentalization work,
Hmm.
what
Hmm.
I'm interested in is I've seen a lot of the mentalization work with BPD
Hmm.
has mixed results, but in all of the questionnaires that I see or the measures, it asks them to mentalize about 2 other people, and they are not
Hmm.
included in the equation. So I basically switched the measures to include them in the equation so that
Hmm.
they're mentalizing about themselves and someone else. And the reason I'm
Hmm.
doing that is because it seems like if you hate yourself
Hmm.
and you see yourself as essentially flawed, then that would affect how you think that others view you. So
Hmm.
maybe if somebody, slights you in some way or doesn't even, then you might think, well, that's because they hate me or that's because they see what's essentially worthless in me. Do you
Hmm.
find those
Yeah.
kinds of errors? Okay.
Yeah, 100%. But it's and this is why trying to disprove it through any kind of affectionate statement or a statement of compassion just doesn't work, because if I say to that person who sees themselves in that way, I actually don't see you that way. I see you with kindness. I see you with compassion. And said, well, you have to say that because you're my parent. You have to say that because you're my therapist. It's like, or you're so deluded that you cannot see the rottenness within me, and they truly cannot conceptualize that they are uh, that they can be seen in that way, because that's not how they experience themselves. Hmm.
What, I mean, this might be taking a peek into what's in your book, but what do you do then? Like I really resonate with what you're saying as a therapist, that when you deal with the self-hatred, that really hard core belief of I'm unlovable, I'm terrible, you're just saying nice things because you're paid to do it, there's my therapist,
Right.
blah
Yeah.
blah
Yeah. Yeah.
blah. Then
Not
what? Like
enough. You don't pay me enough to say
you
those nice things.
what do you do? Like, how do you,
Yeah.
what is the
Yeah.
most effective way of helping people through their self-hatred?
Hmm. Okay, let me ask you this. I mean, and again, and if it feels like an impertinent question, just tell me it is. But I mean, would you both identify as women?
Yes.
100%.
Yes.
I mean, it depends on how we define gender identity, but yeah.
Yeah.
Pretty much. Okay. Now, what if I said to you, listen, we were hanging out in Iceland, and I took Why not? Iceland seems like a cool place. Well, I've been there, but
Right?
so and I took some DNA from the cup that you were drinking from, and it turns out that you're both XY. Now, how? And I said, you know what? You're actually genetically a man.
Mhm.
How could I convince you that you're not a woman by showing you the test results? And not only that, could I convince you that you have to change whatever feminine stereotype you're presenting with and the way that you're acting and do things differently. So you have to, like, I don't know, sit around on a Sunday, belching beer while you're watching
I mean,
yeah.
I'd have to believe there's a really good incentive. Like, is my life gonna just like radically become a lot better if I cut off my boobs and sit around drinking beer and
But
bourbon?
I mean,
Probably.
could you internally identify in that way?
I think that would be very difficult.
Very difficult.
Yeah.
And what if I told you, and like you were coming into therapy, and I said to you, okay, listen, we have to talk about why you're avoiding being a man. What would eventually happen to our relationship?
Yeah, wouldn't
Wouldn't
trust
go
you.
well.
Yeah.
Yeah, I mean, like, listen, we've talked about this. This is nonsense, like I know. I mean, you have to explain why I've had a baby who's 2.5 and running around with a sock, and and no matter what. So the thing about it is that in the early stages, like telling somebody that they're lovable, that's
Yeah.
how fused it is with their identity.
Mhm.
There is no convincing them that they're wrong about themselves. Okay, so. Now, so the first thing I have to do is I have, like nothing I did. I said, practice loving compassion, and I'm a mindfulness like person, and do all these kinds of, and it was as much, it was as invalidating as me telling you to start considering yourself as being male. And by the way, this is just like it's a simple kind of analogy to like thinking the world in a very binary way. But I'm just for the sake of the of the
Yeah.
of the example. And how can you believe something that no amount of you saying, Kibi, like for the next year, I'm going to believe I'm a man is going to get you to really believe that that's true. So it's like, it's so this idea of practicing loving yourself, practicing any of these things is not going to work unless you're willing to accept that 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 concept is fundamentally wrong, and that concept was learned. Do you both speak English as a
Mhm.
first language?
Yeah.
Yes.
¿Y alguno de vosotros hablas español o no?
No.
No. Okay, why not? Because that's not what you were brought up learning. You were
Yeah.
brought up learning English. And so what I say is like you were taught, you're a highly sensitive person who was taught that you weren't enough. And who were your teachers? Who were the teachers who taught you that? And why is it that you continue to listen to those teachers? Uh, And why is it that you don't listen to the teachers who are teaching you something much more fundamentally beautiful, much more fundamentally true about you? So you learned how to hate yourself. But if you learn how to hate yourself, you can learn how to love yourself because love comes much more naturally to the human heart than hatred does. And uh and but it's a learned behavior. And so what I and th- there's an interesting thing that happens. A lot of my patients have tell me that uh, their parents are always giving them advice, and I often ask them advice on what? On advice on how to be happy. And I say, "Are your parents happy?" And they say, "No, they're not." So, well, why are you getting advice from unhappy people? They're teaching you how to be unhappy. We get so much advice from unhappy people as if their advice is good advice.
Mhm.
And it isn't. And if it was good advice, well, then they'd be happy, but they're not. And I said, do you want to end up being like that unhappy person? And they said, no, I don't want to be like that. Well, then don't stop taking advice from them. No, they're telling me I should do this, this, and this. I'm saying, okay, well, you know what the outcome's going to be. So, so what about saying, rather than learning, and by the way, those people that were so hurtful to you, I'm not hating them. You cannot overcome hatred through hatred. I'm not hating them. I'm just saying they are a product of their environment, of their biology, of their circumstances. And the behaviors that ensued from who they were treated you in this really toxic way. The problem is you began to believe their toxic message. And it was fake news. It was absolutely fake news. And you got to, like, so we have to start. So you drive that wedge. You say, okay, every time they bring it up, no, you learned that. That was learned. And sometimes you don't know, but I'm saying as often you can see how maybe there was school bullying, maybe there was a sexual, physical, emotional abuse, maybe there was a lot of invalidation, maybe there was a lot of comparison with, other functioning kids.
Yeah, so
So
really,
that's how I first start. Yeah.
yeah, identifying the source of where you learn that and trying to evaluate whether that
Yeah,
makes sense moving on.
exactly.
Well, speaking of fake news, it's interesting. I'm going to bring up the different reactions to your book of I Hate Myself.
Hmm.
There's a one segment from MSNBC and there's a one from Fox News.
Hmm.
And the Fox News one was surprising, or maybe not for people listening, that they said they were kind of like, well, maybe it makes sense that that person hates himself, and maybe self-hatred is actually good. I mean, you should hate yourself if you're a bad person.
Hmm.
Which at first I was like, this is so silly. But
Hmm. Hmm.
we do we do talk about how sometimes self-doubt or negative thoughts could be functional.
Hmm.
Like what, and also sometimes you have patients who say, I hate myself and I've done horrible things. And then you listen, you're like, well, that wasn't great.
Hmm. Hmm.
And
Hmm.
then you have some patients
Yeah.
who have no self-doubt,
Hmm.
maybe should have a little bit of a,
Hmm.
I won't say self-hatred, but a little touch.
Hmm.
So can you talk about that? Can you talk about the different perspectives on self-hatred, and maybe
Hmm.
even more than people, like we're talking about, okay, yes, you should learn to love yourself, but like,
Hmm. Yeah. Well, let me ask you something. I mean, how many of these shows have you done, would you
Oh,
say?
130 or something?
mhm.
130. Has there ever been one that you were just like really upset with, really dissatisfied with? Like just like, wow, that didn't, out of those 130, could you think of like the top five and maybe like ones that, oh, wow, that didn't go as well. Maybe there were technical issues, maybe, I don't know.
No, we've been perfect. It's just,
Amazing.
That's
it's just,
incredible. That
yes,
is that is
it's like
fantastic.
10 out of 10 every time. Yeah,
And you know what? I think you should put your child on right now and let me tell your child what a fabulous mother he has, that
perfect.
and that not to complain about the socks anymore. So if something were to happen and you were to say, okay, like that didn't go the way that we were expecting, it wouldn't be because I am a flawed individual. It's like maybe I didn't prepare enough. Maybe I don't know, the guest um, you know was just not on. Maybe they we had the wrong guest. We got the wrong, you know, Brene Brown. We got, so there was something wrong about, there was something that happened, but it's not because you're flawed. It's
Mm.
because something didn't work out. So that's something that's external to you, and that you can fix. Because so I think that if you use self-criticism, self-judgment as a way of correcting something, then that's okay. I mean, I'm not saying, like have blind and bland love for yourself. And, we all screw up and we have to correct those mistakes. So, uh, so in that context, a little bit of self-judgment, self-criticism, self-blame is fine. But when it's everything is because I'm so flawed, you know, uh, then um, then you're stuck in a state of like, well, then nothing can ever go right, because if things go right, it was luck, and if things go wrong, then it was your fault. So okay, so I drive this wedge, and And then I start to kind of examine moment by moment when self-hatred is getting stronger, when it goes down. And typically self-hatred gets stronger in the context of people that they're not very happy with, and self-hatred goes down when they're in connection with people that they love. So if we get back to your original question, which was MSNBC, recognizing the value of examining this topic, and maybe Fox News saying, not so much, maybe you should hate yourself, or using it as a prop for attacking people that they have political differences with. My problem with that is, look, I'm all for a good joke, and I'm all for a good political joke. But when you take a vulnerability factor that a human being experiences that might lead them to take their life, I just think that you've done a disservice to those who suffer from the experience. And I actually emailed the host and said, look, I mean, I think that one or two of the things that they said were kind of ridiculous, somewhat funny, but at the same time, can we take the other side of it so you don't show a level of ignorance and disdain and disregard for people who are suffering.
Agreed.
Shocked to
I
hear that Fox has done us a disservice. What were you going to say, Katie?
I mean, it kind of touches on something that we're seeing across the board in our society, where there's, I hate myself, I'm worthless, or the other side, which is no, like, charge ahead, let's be strong, let's dominate, right? There's like this conservative movement of don't doubt yourself. In fact, storm in with full confidence, and that's the approach to strength.
Mm-hmm.
And there's going to be people who still feel that way inside, and learn, oh, I'll just have to project the opposite. So you're
Mm-hmm.
right, it's very dangerous
Mm-hmm.
to
Mm-hmm.
make fun of that struggle inside.
Well, and I think, it's not as if self-hatred goes to the voting booth and says, are you a Democrat or a Republican? Are you conservative or are you liberal? And if you're one or the other, then I'm going to latch on to you. I mean, that's true of any condition: diabetes, asthma, arthritis, cardiac illness, and stuff like that. It's not as if, any of these conditions is picking one person or another. And at a time when deaths of despair are an all-time high, when suicide rates are an all-time high, um, and we're talking about closing the borders because of fentanyl coming into the country, or increasing tariffs by 25% because of fentanyl coming into the country. Why? Because the tragedy of these deaths of despair is so heartbreaking. Then if we think about what are the vulnerability factors, what are the conditions when people die, maybe through overdose or by suicide, that that is so trivialized. I think that was the sadness of the of that Fox segment.
Mm.
Mhm.
I'm trying to think. I don't know that I want to go in this direction, but I am trying to think if I see traits along the political lines that would lend themselves to healing from this. Um, I can kind of see an argument for both, but so you start by there. Whenever I have a patient with a lot of self-loathing, I always have this somewhat absurd, well, it's logical, but emotionally absurd reaction, which is like, this is so pointless. Like,
Mhm.
none of this isn't doing you any favors. This is just serving to prevent you from having any kind of like reparative action in your life to
Mhm.
show that you could be happy and could be lovable. But
Mhm.
then when I think about my own like body image issues, since literally up until I got liposuction, you couldn't talk me out of it. It was just this thing like, I just don't like my body. So how
Mhm.
am I supposed to start liking it? And there also felt like there was this point to hating it. Like if I keep hating it, then I'll get better, which is kind of what you're talking
Mhm.
about
Exactly.
judgment, criticism.
Mhm. Mhm.
So I know that while it may be pointless, it doesn't just you can't just logic it away. So you're saying that
Hmm.
first you kind of go in and create a wedge between the, their trust of the self-hatred, like, oh wait, this was taught to me by figures that maybe I shouldn't trust in the same way. What do you do next?
Okay. By the way, it's interesting how I really appreciate your vulnerability. So let me just say, that in terms of talking about your own experiences, and I think it's refreshingly honest to have somebody say, "Hey, I didn't like my body, had liposuction, and here we are." Um, but um, uh, but here's the other thing is that you know when I was young, I'd get like Time Magazine or National Geographic once a month, and that would be it. Now we're bombarded with marketing for self-hatred. We market to self-hatred. You're not tall enough, you're not skinny enough, you don't have a six-pack enough, you're not strong enough, you're not athletic enough, you're not smart enough. But by the way, if you buy my product, you'll be fabulous. People are going to love you because you'll be so fabulous. And if you buy my book, which is this one, you're going to it'll make your life so much better. But I think that's it's like we market to your self dissatisfaction, and it doesn't even have to be very big. It's just like, wow, like I don't know, my wrinkles could be just a tiny bit less, or something like that. And so like, and if you do that, like everything in your life is going to change in terms of how you see it. And by the way, I'm not saying that some of those things aren't true. Like some of those things could be true, but it's just that you can never reach that pinnacle because that's something outside of you. It's not something inside of you. Can only ever get to self-acceptance or something that's inside of you. Okay, so you get back to this point. So I drive this wedge between, okay, this was taught. Okay, then I want to be very specific about what the lessons were. Um, um, the lessons were my dad calling me stupid, calling me lazy, calling me, telling me I was never going to succeed, and that message being repeated over and over and over again. Okay, so that was one of your teachers. The bullies at school who called me fat or who called me, I don't know, whatever that label was that stuck so strongly. The teacher who told me that I should leave piano because I was just never going to be good at piano. Any uh, negation of a person's effort or a person's capacity, uh, comparison with somebody who was more talented, without any mitigation, without any recognition of the value of that human being as a human being. I want them to actually write it down. And I'm saying, wow, look at all of this. These are your teachers telling you these things. And then it's often there's such powerful voices that you cannot hear the voices of the kind people. And then to an earlier point, you just stop believing them because you say the toxic people must be right, and the kind people obviously cannot see what the toxic people see in me. So I say, okay, like now, and then I do a very interesting thing, and this is uh, something that I worked out with a patient. Is I got them to bring photographs of, I think she was 19, of every birthday from 1 to 19, and I put them down, and you see the change every year. Year two, they have a sock in their mouth because they stole it from Kibby. Um, and I say, tell me when you start hating her. Tell me when you start hating that little girl. And they can't. They want to reach back in time and grab her in their arms and just uh, tell that little girl how much they love her. And then they see the education that child received that told her she was so worthless.
What does
Yeah,
healing look like at that point when they start to soften and
yeah.
change and around those thoughts and beliefs? What do you see healing look like at that point?
I had a patient who said to me that she'd always dated these toxic men. By toxic men, it's just like men who would not, they didn't feel valued by, but they felt that they deserved because they were so flawed. And one day she told me, uh, as she broke through, as she began to see how that toxic messaging had led her to make toxic relationship choices. She I was teaching the interpersonal effectiveness skills of DBT, and and he said, "Well, what's that?" He says, like by doing this, I'll be. She misused the word, but she says, "I'll be a better person." And then he said, "Well, good, because you need to be a better person." And she stops and she thinks about this, and she says, "You know what? If I'm a better person, I'll get a better boyfriend." That was brilliant. That was so fantastic, and it was sort of like, yes, you're seeing that you deserve more than what you've learned to believe is the best that you can get. And again, I did not want her to hate this guy. I mean, I said, I'll do all the hating for you because I didn't like how he was treating her. But nevertheless, who knows? I don't know how he's been maltreated, how he's been abused, and everything like that. It's just that that is not her destiny. It's not what she deserves. So you start to see um, healthier choices,
Mm.
um, uh, living up to their potential in terms of academics, in terms of employment, um, learning how to say no, stop people pleasing, less perfectionism. I mean, people pleasing is such a red flag for self hatred. Um, it's I will do whatever it takes to get you to like me. To the point of devaluing yourself, and the person then gets whatever they want and moves on, and you're left resentful because you get nothing back. Doing the right thing for you is never doing the wrong thing for someone else. And the corollary is like doing the wrong thing for you is never doing the right thing for somebody else.
Um, I'm rifling through patients in my head right now of
Mm.
like when I could have used these interventions. Is there a difference? I'm thinking about that wedge, trust wedge of like, do we
Hmm.
really trust these people who have given you
Hmm.
these messages? And
Hmm.
I guess I'm like, okay, so what if, you ask, like I had a patient who was bullied in middle
Hmm.
school.
Hmm.
And so those are the people presumably who gave her that
Hmm.
message. But we don't
Hmm.
know if they're happy now. We don't, because
Hmm.
at the time she probably saw
Hmm.
them as cool, pretty,
Right.
likable.
Hmm.
What happens then?
Yeah, but I mean, it doesn't actually matter because I just want to know those were the teachers at that time. It doesn't matter how they've turned out.
Yeah.
And we don't actually know what their lives are like, and that shouldn't be our focus in any case. They may turn out fabulous, posting pictures of themselves in bikinis on yachts in the Mediterranean, or I don't know, sitting in the toilet with dysentery after a trip to down the Okavango swamps. I mean, who knows? Who knows what they, but it doesn't matter because it's not about this. It's just that those were the teachers. Who knows how they turned out? And it doesn't actually matter how they turned out. And even if they seem outwardly happy, we don't know the lives of others. So it's like saying, okay, those were the lessons. It doesn't matter how where they are now and what they're doing now. It matters how you're doing now. It matters that you've carried the weight of those lessons, and that weight has been such a burden. I do this exercise with some of my patients. I get them to hold out a 2 pound weight. And Kibby, how heavy is your kid?
Very heavy, more than two
Okay, there we go.
pounds.
More than two
So
pounds.
40
And
pounds. Yeah.
there we go. And you can hold him. But if you think about, okay, so you could hold out a 2 pound weight, given that you can do 40. And now, but if you hold it out like
Hmm.
that, you're holding it out, holding it out. Eventually, you're saying, wow, this is getting really heavy. And I'd say, okay, well, let's put it down and weigh it. And it would still be 2 pounds. But the longer
Mm.
you hold on to something, the heavier it feels. The longer you hold on to those messages of toxicity, the heavier they feel, the more they weigh on you, especially if you're an emotionally sensitive person.
Although to Jacqueline's point, what's interesting about sometimes when people reevaluate who taught them to hate themselves, like these messages of being successful, being beautiful, being like your brother is the
Yeah.
way for me to love you.
Hmm.
I see sometimes that they can get to the point where they recognize who the teachers are, but then having to doubt that or question that could dismantle a lot of their lives, right? Oh, if
Yeah.
if my if my dad's messages of what's right and wrong, and to hate myself or love myself are incorrect, well then he's wrong, and this might threaten my whole. Maybe he's a bad person, and then maybe this ruptures my whole relationship with him, right? There's a
Hmm.
kind of like a
Yeah.
holding on of these beliefs
What
sometimes.
can you trust that he's taught you versus what can
Yeah,
you
that's
trust?
fair, but this is where wise mind comes in. I mean, like that here's the thing is like when you feel shut down, when your body contracts, it's a bad lesson. You know, when your body shuts down,
Mm.
when you're sick, your body shuts down and you contract. What happens when you like experience love and experience joy? It's like
Mm.
expansion, so your body's actually telling you whether something's toxic or not. And I think, from a DBT point of view with dialectics, it's not every message is a toxic message and not every positive message is useful. Telling me that I can dunk a basketball, I'm old and decrepit, and I mean, I can barely, put my arms around the rim of the, I mean, touch the bottom of the net. So, I mean, some things are just true, but it's really examining. Okay, so you say, okay, like that was the student. Now, by the way, often what we find is that a parent uses the same technique with all of their children. Said I yelled at the oldest. He turned out okay. I yelled at the middle one, and she turned out okay. But this one, I tell her get up and do whatever it is. Starts crying. That's because they're highly sensitive people, and so the well-intentioned techniques that a parent uses with one child and with two children. If your child's allergic to peanuts and your other one isn't, one's going to have a reaction that the other one isn't going to have. And
Mm.
and now it may not be intentional that they're getting these messages, that the parent is delivering those messages. It just might mean that, look, okay, we're not going to sit here and say that because your dad taught you these messages that he's a fundamentally terrible human being. I don't want to get into that. And in any case, hating somebody to stop hating yourself just doesn't work. Hatred does not cure hatred. So it's sort of saying, okay, I learned these lessons, but maybe they were just like they were teachers who'd been taught that way themselves. I learned that the word concha is a Spanish word for a shell. I used that word in Ecuador when I was teaching, and it is uh, the word for intimate female anatomy. And I was there, lecturing away, talking about like this wonderful shell,
Vaginas.
the wonderful shell that I had found on the beach, and it was nice and smooth on the inside, and I could put it to my ear, hear the ocean, and it smelt a little bit like fish, and it was like going, and I could see the students like mortified, because I had been taught. So the word is correctly that in Spanish. It's how I understood the word. But I was, like in that in the different context, did not come out so well. So the point is, okay, that was a mistake. Now people could go home and say, oh my God, like this American professor came and gave us the most disgusting teaching ever, about female vaginas, and but then there somebody could say, oh, you know what, like, okay, he mislearned, like that was it. What was the context? And then say, okay, like that was bad teaching. let's correct that. Can you go back to a parent and say, you know what, those were actually hurtful, and I know that may not have been intentional, but nevertheless it had a certain impact. There was some attempts to, I was, like going on to going down to New York and doing some of the morning shows, but they haven't panned out yet because there's a lot of political news in the news
Right.
cycle, and so that this hasn't taken on. But yeah, so we'll see. But yeah, no, I'd
Yeah.
love to hang out and happy to. I just love teaching and yeah.
Well, can you tell us where, we'll definitely put the link to your book in the show notes, but is any
Mm-hmm.
other resources or where
Mm-hmm.
that people can find you or talk to you or
Mm-hmm.
anything else that you want to give to the listeners?
Yeah, no, I mean, I think our website, but I mean, our website's a treatment program, so it's the continuum, whether it's outpatient, residential, or partial hospital. But people send me, kind of emails, and I think, in the book, I've added a lot of like mini little worksheets, so that because I think that the flood of emotions as they come are so powerful that by stopping and getting the person to do some reflection, so I think in the book that there's all these exercises, but I think that we're at the beginning of a journey of really examining this concept of self, this concept of who we are as human beings. And I think that in this day and age, um, uh, the self-absorption leads us to a level of self-hatred that is kind of unprecedented. So, and I think that we're going to see more and more of it. And I think, I mean, I wrote this. I've written 20 books, and run,
That is
run
fun.
57 marathons. You know. So I mean, so like I live a very extreme life. I mean, a very like I live on the intense age of life, and but this one, I can really churn out a book quickly, but this one took 2 years because it was so important. I think to me, it's my most important book, because it is so antithetical to my experience to see somebody who I so deeply love to hate themselves. I just and now the problem is that all my patients who now love themselves, they won't leave me alone. I mean, they're so frigging annoying. They send me pictures of their ultrasounds and of their marriages and of their babies, and like I'm not your therapist anymore. Get frig off. I said never.
Stop loving yourself.
Yeah,
Too busy.
exactly. Leave me alone. But I just it's just wonderful to stay connected. I mean, they often will travel once a year to come to Boston to come and say hi and bring their families, or
Oh,
go and grab a coffee. And yeah,
it's lovely.
I'm literally putting this in my Amazon cart after we hang up because I have a patient who struggles with this, and it can make you feel so incredibly helpless. So,
yeah, yeah, yeah.
yeah.
No, I think yeah, the only thing is if thank you so much. Just in terms of recommendation, because of uh, the Fox piece, there was a little bit of like negativity. If you review it and you think that it's worth anything, like one thing that can help is sort of like supporting it on Amazon by saying 5 stars or whatever it is.
Yeah.
Just in terms of like because I think there's a sense of like it being that there's a self-indulgence, and I think that people are mistaking kind of superficial self-dissatisfaction with the self-hatred that
Right.
is going to take someone's life. So
Right.
Well,
guys,
we're
you are beautiful and wonderful, and Kibby, if I come down, I'm definitely bringing socks for the little guy to drive you nuts.
Well, we're in New York, so please, and
Yeah,
we would love to also come and visit,
yeah.
if there's any kind of mentalization based training.
well, Little Helpers. Now I'm about to beg for 5 stars. So after you're done reading Blaise's book, give him 5 stars. Then come on here and give us 5 stars, and we'll all be so happy and we'll love ourselves. For now, see you later, and you'll hear from us next week. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.